In this video, we will delve into the updated NICE guidelines on hypertension, which were revised in November 2023. These guidelines are crucial for healthcare professionals, particularly those in primary care, as they provide a comprehensive framework for diagnosing and managing hypertension effectively. Understanding these guidelines is essential, as hypertension is a prevalent condition that significantly impacts patient health and well-being. The updated recommendations emphasize the importance of early detection, accurate blood pressure measurement, and individualized treatment plans tailored to each patient's needs. We will explore the key changes introduced in the latest guidelines, including new thresholds for diagnosis and treatment, as well as the recommended lifestyle modifications and pharmacological interventions. By familiarizing ourselves with these updates, healthcare professionals can enhance their practice and improve patient outcomes. Throughout this video, we aim to clarify the relevance of these guidelines in everyday clinical settings and highlight the critical role that primary care providers play in managing hypertension. We encourage viewers to engage with the content, as we will provide practical insights and actionable strategies that can be implemented in practice. By the end of this video, you will have a clearer understanding of the updated NICE guidelines and their implications for hypertension management in primary care. The updated NICE guidelines on hypertension cover several critical areas, providing a structured approach to managing this widespread condition. However, it is important to clarify that these guidelines do not specifically address chronic kidney disease, CKD, type 1 diabetes, or pregnancy-related hypertension. Instead, they focus on the general population, with particular emphasis on managing hypertension in individuals with type 2 diabetes. This inclusion is vital, as type 2 diabetes is often associated with increased cardiovascular risk, making effective hypertension management essential for this demographic. The guidelines outline evidence-based recommendations for blood pressure targets, lifestyle modifications, and pharmacological treatments tailored to the needs of patients with type 2 diabetes. Furthermore, the guidelines underscore the significance of primary care relevance in hypertension management, recognizing that primary care providers are often the first point of contact for patients. By equipping these professionals with the latest evidence and best practices, the guidelines aim to enhance the quality of care delivered to patients with hypertension. This focus on primary care ensures that healthcare professionals are well prepared to identify, monitor, and manage hypertension effectively, ultimately leading to improved patient outcomes. As we explore these specific areas, we will highlight the practical implications for everyday clinical practice, ensuring that healthcare providers can implement these guidelines with confidence. Accurate blood pressure measurement is essential for effective hypertension management, and the updated NICE guidelines provide clear protocols to ensure precision. First and foremost, it is crucial to always palpate the pulse before measuring blood pressure. This step helps to identify any irregularities that may affect the accuracy of the reading. For patients exhibiting pulse irregularities, manual measurement techniques are recommended. This approach allows healthcare professionals to obtain a more reliable assessment, as automated devices may not perform well in such cases. Additionally, for patients presenting with symptoms of hypotension, such as dizziness or lightheadedness, it is important to consider postural blood pressure measurements. This involves taking readings while the patient is seated, standing, and lying down to assess how blood pressure changes with position. This protocol can help identify orthostatic hypotension, which may require specific management strategies. By adhering to these guidelines, healthcare providers can ensure that blood pressure measurements are both accurate and meaningful, leading to better informed clinical decisions. Overall, these protocols emphasize the importance of a thorough and methodical approach to blood pressure assessment, ultimately enhancing the quality of care for patients with hypertension. As we discuss these protocols, we will provide practical tips to help healthcare professionals implement them effectively in their practice. Diagnosing hypertension accurately is a critical step in effective management, and the updated NICE guidelines outline a systematic process to achieve this. The first step involves measuring blood pressure in both arms during the initial assessment. This is essential to check for significant differences, as discrepancies can indicate underlying vascular issues that may require further investigation. If the initial measurements are high, it is important to confirm the diagnosis of hypertension by taking multiple readings on separate occasions. This approach helps to account for any potential white coat syndrome, where patients may exhibit elevated blood pressure due to anxiety during medical visits. To enhance diagnostic accuracy, the guidelines recommend utilizing ambulatory or home blood pressure monitoring. These methods allow for blood pressure measurements to be taken over a 24-hour period or in a familiar environment, providing a more comprehensive picture of the patient's blood pressure patterns. This is particularly useful for identifying masked hypertension or fluctuations that may not be evident during a single clinic visit. By following these guidelines, healthcare professionals can ensure a thorough and accurate diagnosis of hypertension, paving the way for appropriate management strategies. Throughout this discussion, we will highlight practical tips for implementing these diagnostic processes effectively in clinical practice. Assessing target organ damage in patients with hypertension is crucial for determining the extent of the condition's impact on overall health. According to the updated NICE guidelines, several investigations are recommended to evaluate potential damage effectively. First, conducting urine tests is essential, specifically to check for hematuria and to calculate the albumin to creatinine ratio. These tests help identify any renal impairment or early signs of kidney damage, which can be critical in managing hypertensive patients. Additionally, performing renal function tests is vital, as they provide insights into the kidney's ability to filter waste and maintain fluid balance. Alongside this, checking total cholesterol levels is important, as dyslipidemia often accompanies hypertension and increases cardiovascular risk. Furthermore, examining for hypertensive retinopathy is a key component of the assessment process. This can be accomplished through a fundoscopic examination, which allows healthcare professionals to visualize changes in the retina that may indicate chronic hypertension. A 12-lead ECG is also recommended to assess for any cardiac abnormalities that may arise due to prolonged high blood pressure. By following these guidelines, healthcare providers can gain a comprehensive understanding of the potential target organ damage in hypertensive patients, enabling them to tailor management strategies effectively. Throughout this section, we will discuss the significance of each investigation and its role in guiding clinical decisions. Managing patients diagnosed with hypertension involves a multifaceted approach that combines lifestyle modifications and pharmacological interventions. First and foremost, offering lifestyle advice is crucial. Healthcare professionals should encourage patients to adopt a heart-healthy diet, such as the DASH, Dietary Approaches to Stop Hypertension diet, which emphasizes fruits, vegetables, whole grains, and low-fat dairy while reducing sodium intake. Regular physical activity is also essential. Patients should aim for at least 150 minutes of moderate exercise each week. Additionally, smoking cessation is a vital component of management, as tobacco use significantly increases cardiovascular risk. When it comes to pharmacological treatment, antihypertensive medications should be initiated based on specific blood pressure thresholds outlined in the guidelines. For instance, treatment may be recommended for patients with stage 1 hypertension if they have additional cardiovascular risk factors or established cardiovascular disease. It is also important to consider individual patient factors when prescribing medication, including age, comorbidities, and potential drug interactions. Tailoring treatment to the patient's unique circumstances can enhance adherence and improve outcomes. By integrating lifestyle changes with appropriate medication management, healthcare providers can effectively control blood pressure and reduce the risk of complications associated with hypertension. Throughout this discussion, we will explore specific strategies and medications that can be employed to optimize patient care in hypertension management. The updated NICE guidelines provide clear recommendations for the use of antihypertensive medications, emphasizing a structured approach to treatment. For appropriate patient demographics, particularly those with uncomplicated hypertension, the initial treatment should typically involve either ACE inhibitors or angiotensin II receptor blockers, ARBs. These medications are particularly beneficial for patients with conditions such as diabetes or heart failure, as they offer renal protection and cardiovascular benefits. In cases where patients may not tolerate ACE inhibitors or ARBs, or if additional control is needed, calcium channel blockers or thiazide diuretics can be utilized. These alternatives are effective in managing blood pressure and can be tailored to the individual's response and tolerance. For instance, thiazide diuretics are often recommended for older adults, while calcium channel blockers may be more suitable for younger patients. As treatment progresses, it is essential to monitor blood pressure control and assess patient response regularly. If blood pressure remains elevated despite initial therapy, healthcare providers should consider advancing through the treatment steps. which may involve combining medications from different classes to achieve optimal control. This stepwise approach ensures that treatment is personalized and responsive to the patient's needs, ultimately leading to better management of hypertension and reduced risk of cardiovascular complications. Throughout this section, we will discuss specific medication options and their indications in greater detail. Monitoring and follow-up are critical components of effective hypertension management, ensuring that treatment remains effective and safe for patients. Regularly checking blood pressure is essential to assess the efficacy of the prescribed treatment regimen. Consistent monitoring allows healthcare providers to determine whether the current management strategy is successfully controlling blood pressure or if adjustments are necessary. This ongoing assessment is vital for preventing complications associated with uncontrolled hypertension. In addition to routine blood pressure checks, it is important to monitor for symptoms of postural hypotension, particularly in at-risk patients, such as the elderly or those on multiple antihypertensive medications. Symptoms like dizziness, lightheadedness, or fainting can indicate significant drops in blood pressure upon standing, necessitating a review of the treatment plan to ensure patient safety. Furthermore, treatment plans should be adjusted based on patient adherence and blood pressure readings. Understanding a patient's ability to follow the prescribed regimen is crucial, as non-adherence can lead to suboptimal blood pressure control. Regular follow-up appointments provide an opportunity to discuss any barriers to adherence, reinforce the importance of lifestyle modifications, and make necessary adjustments to medications. By prioritizing monitoring and follow-up, healthcare providers can enhance patient outcomes, reduce the risk of cardiovascular events, and promote a collaborative approach to managing hypertension effectively. Throughout this discussion, we will explore practical strategies for implementing effective monitoring and follow-up in clinical practice. In this video, we have explored the updated NICE guidelines for hypertension management, emphasizing their critical role in enhancing patient care. Understanding these guidelines is essential for healthcare professionals, as they provide a structured framework for diagnosing and managing hypertension effectively. We discussed the importance of accurate blood pressure measurement, the process for diagnosing hypertension, and the necessary investigations to assess target organ damage. Additionally, we highlighted management strategies, including lifestyle modifications and the appropriate use of antihypertensive medications tailored to individual patient needs. We encourage all viewers to apply these guidelines in their clinical practice, as doing so can significantly improve patient outcomes and reduce the risk of complications associated with hypertension. By integrating these recommendations into everyday care, healthcare providers can ensure they are delivering the highest standard of treatment to their patients. If you found this video informative, we invite you to subscribe to our channel for more valuable content on hypertension management and other healthcare topics. Don't forget to like and share this video with your colleagues and peers, as spreading knowledge is vital in our collective effort to enhance patient care. Your engagement helps us create more resources that can benefit healthcare professionals and ultimately improve patient health outcomes. Thank you for watching.